It's time for The Tao Show with your host, Tao.
Hello everyone, welcome to the Dao Show. So today's topic is about good doctors and bad doctors. When I walk into a doctor's clinic, I'm in a state of panic and I'm waiting for my chance to make a run for it. So I expect my doctor to make me feel safe for at least the duration of the consultation. So stay tuned. Now I would like to invite our first guest, Dr. Ben. Good afternoon, Dr.
Hello,
Ben.
it's such a pleasure to meet you.
It's a pleasure to meet you too. So our theme today is good doctor, bad doctor.
Oh,
So guess what we did last week?
what did you do?
My assistant Wanya managed to hit a hidden camera in her handbag and she filmed the doctor-patient interview.
Oh, okay.
Okay, so do you still remember her?
Vanya.
Yes.
Was she the sexy one with the chest pain?
Yes, she's the one!
Yes, I remember Vanya. She was the really nice girl, right?
Yes, she's my assistant.
Oh,
Okay, let's watch the video, shall we?
okay, sure.
Oh, hi, Dr. Ben. Hello, Dr. Ben.
Huh? Oh, sorry. Hi, Miss Lalji.
Call me Vanya, that's fine.
Okay, Victoria. So, what brought you here today?
No, my name's Vanya.
Okay, Valerie. What brought you here today?
Right. I have this really bad pain in my chest and it's radiating down to my arm. Sometimes the back of my neck, my ears are hurting and I find it difficult. Yeah.
Oh, has it spread to this area?
No, Dr. Ben.
Okay, that's interesting. So, how long have you been having this pain then?
It's been a while. I'm not too sure, but it's been a while.
Oh, well, couple of months.
No, Dr. Ben. Maybe less than a couple of months.
A month.
No, a few weeks.
Okay, fine. A few weeks. So, could you please describe more on this pain then? Is it a stabbing pain, throbbing pain, aching, childbirth?
No, Dr. Ben. It's just a dull pain, and it's in a lot of places. That's why.
Okay, dull pain. So, could you please elaborate more on how you cope with this pain?
Oh God, it's been terrible. I've been taking a bit of medication, an aspirin a day at least. I find it difficult to take the kids to school. Arm starts hurting. My whole Dr. Ben, are you listening?
Oh, of course. Yeah, I was listening. Please continue.
So, you don't really listen to what your patient has to say?
Well, actually, it's a very normal thing for doctors to do that, and I think all of you know that I'm a very busy man.
Yes, I understand, but listening to your patient is probably the most important thing you could do to obtain information, isn't it?
I mean, yeah, but when you're a great doctor like me, you don't have to listen to the patient. You could just look at him and know what he has.
Yeah, right. Let's continue.
Okay. Okay, now, Vanya, is it okay with you? I'd like to ask you a few questions about your personal life.
Yes.
Is that okay?
Yeah.
So, do you smoke?
I smoke socially, yes.
Very funny, okay. But seriously, how many packs do you smoke a day?
No, really, Dr. Ben. I smoke socially.
Okay, social smoker. So, do you drink?
No, I'm a teetotaler. I don't touch alcohol.
Really?
Yes.
That's very truthful. So, do you have a family then?
I told you actually. I have 2 kids.
Oh, yeah, you're a mom, right?
They're a handful.
So, anyway, based on what you've told me so far, you said you had a pain here,
No, Dr. Ben.
and then you said you've had it for a couple of months,
a couple of weeks.
and then
really,
you drink and smoke on a regular basis.
No, actually, I only
So,
socials.
all I can conclude is that you have breast cancer.
Breast cancer?
Yes,
No, Dr. Ben, you have to
Valia,
mistake
Valia,
it.
shh, Valia, calm down.
Valia.
Valia. Yeah, that's your name, right? Well, I'll schedule a surgery.
Dr. Ben, I don't think
No,
surgery would be
A
necessary.
surgery
really.
would be necessary for
No,
you.
Dr. Ben, breast cancer. Don't you have to any tests? Tests.
Valia, calm down. Let the news sink in, Valia. Let the news sink in. I'll come back with more information about this, okay? I'll be right back.
So, do you have any additional comments about your overall performance?
Oh, not really. I thought I did a great job. How about you?
Oh, I think the way you're sitting is a bit inappropriate.
Oh, come on. I was sitting perfectly fine.
And also, I think your interview room is a bit messy and unhygienic.
You got to be kidding me. My interview room is one of the cleanest interview room in the world.
Oh, please. And also, generally, I think you should show more empathy towards your patients.
I was showing empathy towards my patient. It's not my fault that Vanya was being unreasonable with her attitude just because she haven't eaten her favorite food in a month.
Isn't that supposed to be kept between you and Vanya? A good doctor should keep that information between patients and confidential.
Oh.
There you go, everyone. That is an example of a bad doctor. Thank you very much, Dr. Ben, for your time. I hope this constructive criticism will help you to become a good doctor in the future. Now I would like to invite my second guest, Dr. P. Hello there. Good afternoon, Dr. P. Please take a seat. So last week, my secretary, Wanya, managed to film your doctor-patient interview with her.
How did you manage to do that?
She has a hidden camera in her handbag, but with the permission of the clinic, of course.
Okay.
Okay. So, do you still remember her?
No, I don't. I have a lot of patience, sorry.
She's the one with the chest pain and the Gucci bag?
Oh, okay. Yeah, I do remember her now. Yeah.
Okay. Yeah, she's the one. So, should we get started with our video clip?
Yeah, okay.
Okay.
Good morning.
Oh, hello, doctor.
Hi, I'm Dr. P, and you are Miss Lauji?
Yeah, you can call me Vanya. That's
okay,
fine.
great one, yeah. So, tell me, how have you been doing lately?
Well, I've been having this pain in my chest, and it's starting to scare me a little.
Okay, so how long have you had the pain for?
A couple of weeks, a few weeks, yeah.
Okay, can you describe the pain for me?
It's a dull pain, but it's radiating a lot to different parts of my body.
Okay, so where does it radiate to then?
My arms mostly, my neck, my ears, my chest, yeah.
Okay, so have you noticed anything that brings the pain on?
Driving definitely does because my arms get really tired.
Okay, so have you taken any medication to ease the pain?
A couple of aspirins a day at least, yeah.
Okay. Then, are there any other symptoms that you noticed other than the pain?
Well, there has been a bit of dizziness and nausea, but I think that's just because I'm really tired.
So, what did you think of your performance?
Well, I'm not really sure what you meant by my performance, but that's my job as a doctor, to respect my patients and to treat them accordingly.
Yeah, actually, I think that you did very well because so far your questions are not leading and they are all open questions.
Oh yes, that's important because patients will be able to fully express themselves and doctors will know what is really happening with them and give them the right treatment and diagnosis.
Yeah, and I also noticed that you were listening to your patient very closely based on your body language.
Oh yes, that's also very important because if I don't listen to them carefully, I can miss some little details which are actually important for the correct treatment.
Okay, so I think we should continue with the next part of the clip.
Okay. If you don't mind, I would like to ask you a few more questions about your lifestyle.
That's fine.
Okay, so can I just ask if you smoke cigarettes or drink alcohol?
I smoke socially, but I do not consume any alcohol.
Okay, and how would you describe your diet?
I'm very particular about my diet. I only eat organic foods.
Oh, that's healthy. That's very good. And can I just ask who you live with?
I live with my 2 kids.
Oh, and it's just the three of you?
Yes, my husband and I got a divorce a few years ago.
I'm sorry to hear about that. Okay, so today, if you don't mind, we would like to run a few tests for you.
Yeah, that's fine.
Okay, great. And the hospital will inform you when the results are ready, and I will see you very soon.
Okay, thank you. Thank you so much.
So, Dr. P, what did you think of your overall performance?
Well, as I said before, it's my job as a doctor to do what's best for my patients.
Honestly, I think that you did a much better job than Dr. Ben.
Well, thank you.
Thank you. Okay, audience, please calm down now, okay? Okay, thank you. So, I was just saying that you showed most of the aspects of a great doctor.
Oh, thank you so much for saying that, Dao.
No, thank you for coming.
Okay, thank you for having me today.
Okay, I'll visit your clinic soon, okay?
Yes, you're always welcome.
Take care, Dr. P.
Yes. guys. Bye.
Bye. Okay, that's it for today. Next week we are going to invite Sai to teach us the secret of the Gangnam Style. So stay tuned for next week, and I thank all the audience for coming in today and those of you who watch this show at home. And I will see you then. Okay, bye.
Mental.
Sexy one, yeah.
Opa, Vanya sekarang.
Ah!